Good afternoon, everyone. My name is Millicent Gorham, CEO of the Alliance for Women's Health and Prevention. For those of you who may not be familiar with AWHP, we work to advance policies to ensure equitable access to high-quality, affordable preventive care for women and girls. This month, we celebrate Women's History Month and mark International Women's Day on March 8th. To honor these significant occasions, we will emphasize the urgent need for heightened investment in women's health research. Additionally, we will delve into the crucial role that healthcare providers play to assist women in navigating their screening and prevention choices. For today's discussion, I am thrilled to be joined by Dr. Elizabeth Garner. Dr. Garner serves as president of the American Medical Women's Association, or AMWA, where she has played a pivotal role to advance initiatives focused on anti-racism and gender equity. In 2022, she assumed the role of Chief Scientific Officer at Ferring Pharmaceuticals, marking a notable transition after nearly 15 years of dedicated service in the pharmaceutical industry. How can we address the need for increased investment in women's health research?
Thanks, Millicent, for that really important question. Just super quickly, I want to make it clear what we're actually talking about when we use the term women's health, because I think often when people think about women's health, they think about just reproduction, right? But women's health is so much more than that, right? So indeed, there are conditions that only women have, right? Like endometriosis, fibroids, pregnancy. But then there's a whole host of other conditions that women may be, say, disproportionately affected, right? So like autoimmune disease, maybe people might not necessarily think of, say, rheumatoid arthritis as a women's health problem, but it is because women get autoimmune disease much more frequently than men. And then there are also diseases that women experience differently, right? And a great example of that is heart disease. Women who have heart attacks have very different symptoms often than men. And because of that, sometimes heart attacks don't even get diagnosed for women, right? Because people typically think of the symptoms that men have. So kind of those three parts of women's health, I think it's really important to understand. As you said, though, we desperately need increased investment. There has been really, women's health, I think, has suffered tremendously from serious underinvestment for many decades. There was a report that came out in 2020 that showed that just 1% of the $200 billion that was spent in, at least on the biopharma side, only 1% went to women-specific conditions. That's a tiny piece of the investment in women's health or in health in general. There's also, if you look at, say, venture capital funds, right? Those investors that focus often on, companies that are just kind of trying to start out. There as well, there's tremendous contrast between the largest women's health venture fund versus other larger venture funds, right? We have much less money that's available for investment. So clearly there's a gender bias, right, in funding allocation and really a huge opportunity to change. But you also asked, like, how can we address it? Well, I think things like exactly what you're doing, which is asking the question and keeping it on people's minds, right? And what we've been seeing, the good news is in the past few years, is there is an increasing call for more investment in women, and that's all great. It's definitely raising awareness from, in academic institutions, for companies, investors. And look, hey, even Congress, all the way to the White House, right? So you saw that the White House initiative that was announced last year. So these things, I think, with the increasing voice of women and women physicians and advocates, it is now recognized, I think, that we need more investment.
How does AMWA advocate for women physicians and to improve the lives of women and their families?
I have loved my time as the president of AMWA. Sadly, I only have about a month and a half to go. But it is such a great organization, and it is the oldest organization that's specifically focused on women physicians. We've been around for over 100 years, and our mission is just what you said, right? We advocate for women physicians, and we also advocate to ensure excellent health for women and their families. We do both of those things. For physicians, we have numerous programs that support women from a career perspective, including coaching, mentorship, leadership programs, opportunities for leadership. We're also working on a new mental health program that will focus on some of the really big challenges that women physicians continue to face in the workplace, including pay equity, harassment, gaslighting. All that stuff has been going on for decades, but is certainly continuing to go on, and it's leading to many women actually leaving the workplace now. So AMWA is very, very focused on that issue as well.
Black women face the highest risk of maternal mortality, with a rate of 69.9 maternal deaths per 100,000 live births. How can we address the maternal mortality crisis among Black women in the United States?
One, we need more education, right, for women and for physicians, to be clear. We need better advocacy, more advocacy even than we already have. Trust is a very, very big issue. So back to the question you just answered a little while ago around having physicians that look like you as a patient. This is very, very relevant when it comes to maternity care. We know of many stories, right, of some very famous people even, such as Serena Williams, right, who had challenges after her pregnancy and wasn't listened to, right? So the training also of doctors and healthcare providers around both unconscious bias, but also conscious bias, right? That is aimed often at women of color.
This has been a wonderful conversation. Before we close out, do you have any final thoughts?
For me, every opportunity to talk about these issues is always just so exciting, because it means that, the word is getting out. So thank you really, really for doing this. I think by raising awareness, right, and educating our communities, as your organization is doing, we can really continue to shine a big, huge light, right, on all of these very important issues. And I think we have to be patient. I am not a patient person. I think that you're not either, Millicent, with the times that I've spent with you. But it takes time. It does take time to make these changes, right? So if we just continue on the path that we're taking, and if we continue to bring people together, which to me is really important, getting that whole ecosystem of folks who are involved in women's health together, I think we ultimately will succeed, but it does take time.
Thank you so much, Dr. Garner, for joining me for AWHP's latest fireside chat with women leaders in medicine. I really appreciate you sharing your time and wonderful insights with me. Thanks to everyone who tuned in. We encourage you all to learn more about AWHP at womenshealthandprevention.org. See you soon.